Hello, and welcome to today's webinar, How Does Climate Change Impact Women and Their Health? I am Dr. Barbara Malkus, Board President for Massachusetts Breast Cancer Coalition, and I'd like to thank you for joining us today. Massachusetts Breast Cancer Coalition is dedicated to preventing environmental causes of breast cancer through community education, research, advocacy, and changes in public policy. As senior advisor to the director, Dr. Gwen Collman provides leadership on the planning and implementation of complex, high-priority research programs in many areas of environmental health sciences, including public health, population science, and community engagement. I am very pleased to welcome today's speaker, Dr. Gwen Collman. Over the past 2 years, she has been actively involved in the National Institute of Health's wide RADx Up, which is the Rapid Acceleration of Diagnostics for Underserved Populations, and the SEAL Community Engagement Alliance research programs that focus on COVID testing, vaccine hesitancy, and community engagement. Currently, Dr. Collman is the strategic advisor for coordination of the NIH-wide Climate Change and Health Program. Dr. Collman holds a PhD in environmental epidemiology from the Gilling School of Public Health at the University of North Carolina. During her career at the National Institute of Environmental Health Sciences, she has held positions in the intramural program, extramural program, and the Office of the Director. She is a member of the NIEHS leadership team. Welcome, Dr. Collman, and I pass it over to you.
Thank you so much. It's great to be here. I appreciate that nice introduction, and I'm really excited to be with your audience today. I'm going to try to get these slides up. Go in presentation mode. Can you let me know if you can see them?
Yes, we can.
You see them?
Thank you.
And can you hear me?
And we can hear you beautifully. Thank you.
Okay, perfect. Well, it's very exciting to be able to talk about a very, very important topic with you all today. So I'm sure everybody in this audience is fully aware of how the climate has been changing over the last few decades and the kinds of risks that the planet faces, both from an ecologic perspective, from an environmental perspective, but also you may not be aware that many of these climate change impacts impact health. And I'm gonna walk you through a variety of different slides that outline the health impacts of climate. And I'm going to try to focus specifically on health to women and conditions that I know are important to this audience. So over the last couple of years, the International Program for Climate Change has come out with a few reports that have been very enlightening and sounding an important alarm. So last year's report, the tagline was Code Red for Humanity, meaning very extreme conditions that have great implications for health. This year, a second report came out that was focusing on the impacts, adaptation, and vulnerabilities of populations all over the globe. And the Intergovernmental Panel on Climate Change says that the scientific evidence is unequivocal. There is clear threats to human health and well-being and for the health of the planet, and that any further delay in concerted efforts will miss an important window in order to secure a livable future. So there's a lot of really interesting information in these reports that says we need to think about this carefully and think about action now. So I've been pleased and privileged to be able to lead an activity across the National Institutes of Health. We have been working for over a year on something called the Climate Change and Health Initiative. And our goals for this research program are to reduce health threats across the lifespan and to build health resilience in individuals, communities, and nations around the world, especially those who are at higher risks. So the objectives are to identify risks and optimize benefits to the health of these groups, from actions to mitigate or adapt to climate change. We want to develop the necessary research infrastructure and workforce to be able to employ the generation of timely and relevant knowledge, and we want to pull in the full spectrum of biomedical areas and disciplines. We want to leverage partnerships. We know lots of other groups, both in the US and around the world, are working on these important problems. We don't want to do them alone. We want to do them together. And we want to innovate across what we call the research translation continuum. We wanted to do discovery research. We want the research findings to be credible, accessible, and actionable. So this is our report, and this is the website. We've created a strategic framework that tries to coalesce all of the different inputs that we got from the community, got from a different analysis of research that was already happening, and trying to understand ways forward. And our framework here, what we call our cogwheel diagram, really puts it in context of 4 important pillars. Health effects research with a lens towards health equity. We're really interested in going from documenting impacts to intervention science, and we are very interested in training and capacity building. And around the cogs, you see there's lots of different kinds of research that we think fits into this, this umbrella activity, and we are thinking of it from a global, cross-sector, interagency, and community partnership approach. So it's complicated to think about all of the different drivers for health and disease. And if you want to think about climate change and health, we want to start with climate drivers, right? People think about the variability in extreme weather events, the increased temperatures, how sea level is rising, all kinds of changes related to climate. But then there are the health effects that come from that are also mediated by many indirect effects, both on the health outcome themselves, but also how the climate drivers work together with these other factors to impact health outcomes and resiliency. And so my talk is divided into 2 sectors. One is how climate is a direct driver of health, and then what are the indirect effects of climate change on women's health outcomes. Whoops, pressed the wrong button, sorry about that. Okay, so some infographics to try to visualize what I'm talking about here. So if we think about air quality changes because of emissions and outputs that are happening in industrialized areas. High levels of air pollution may come from intense wildfires or from increased pollution and greenhouse gas emissions. And in these boxes, you can see some of the health outcomes that come along with this: increase in hospital visits, increase in the incidence and prevalence of disease, morbidity and mortality, pollen changes, emergency room activity, and the health outcomes of interest might be cardiovascular events, respiratory, or allergy-related diseases. If you think about extreme weather, you can also come up with a scenario of increased flooding and storms, more intensive wildfires, water contamination, property loss, and infrastructure damage that comes from these storms. You might not think that there are deaths associated, but of course, just from the injuries and outcomes of the direct effects of the tornadoes or hurricanes, we do unfortunately see stresses that add to increase morbidity and mortality. There could be respiratory symptoms that are affected. There's mold that's in the outcomes of these floods, etc. And so lots of ways to think about the health outcomes here. Rising temperatures. Well, just this summer alone, not only did we have higher temperatures, we had different kinds of temperature activity. I heard new things on the weather reports, heat domes, and different kinds of cyclone bombs, and different things that were describing the weather in ways that I had never heard before. And basically what it was saying there was more frequency and intensity related to the health outcome, the weather outcomes that we were accustomed with through our life before. So when things get hot, you know, our communities and our people ready to deal with the rising temperatures. When you have distinct health effects related to heat, you have dehydration, people can have heat stroke, there can be fainting episodes, aggravated cardiovascular disease, and respiratory symptoms. And this happens to the most vulnerable people: pregnant women, children, elderly, the poor, people who cannot escape the heat and get relief. So another community of people that I know this group is quite interested in are people with cancer. And so how does climate change affect the impacts of cancer in our population? Well, I did some review of the publications and I looked at some summary articles, and there are quite a number of reports out there that link climate change related cancer threats from air pollution, increased exposure to ultraviolet radiation that might result in melanoma and skin cancer, industrial toxins, and disruptions in the food and water supply in terms of its cleanliness and its availability. Climate change will exacerbate the social and economic inequities that we know are out there in the communities, and these inequities may in turn relate to increased cancer incidences and outcomes. The biggest challenge of the global cancer burden may come from the disruption of the healthcare system, which requires cancer diagnosis, treatment, and care. And we know that if you are in a community that's been impacted by a hurricane or floods, you may have difficulty getting to your practitioner, and the treatments that you're undertaking, no matter what kind of cancer you have, may be disruptive. And that's a red flag that we should be aware of and try to prepare for. So how does climate change impact our mental health? Well, we have heard in the news and read in the newspapers, people have a lot of stress and anxiety around the future of our planet. A lot of things related to climate change, the impacts and production of greenhouse gases, they seem out of control, and that creates stress, anxiety, depression, grief, and sense of loss. So we'll talk a little bit more about evidence related to mental health, but it's an important health outcome when we think about climate change impacts. So climate change affects everybody around the globe, but doesn't affect us equally. So some underserved populations that already have health disparities, such as communities of color, immigrant groups, the climate migrants that we're seeing around the world, and indigenous populations may be impacted more. People who are working outside during the workday clearly are impacted by extreme temperatures and weather vulnerabilities. People with disabilities, people with chronic medical conditions, as I inferred before for cancer, this is true for almost every medical condition. Lots of healthcare can be disrupted. And you can also perhaps be more susceptible to the impacts of, let's say, mold, if you already have pre-existing pulmonary conditions. We're interested not just in the United States, but there are populations in lower middle income countries around the world. They are not producing the causes of climate change, but they are feeling the effects because of existing diseases, malnutrition, and extreme poverty. And the vulnerability is across the entire lifespan. So during pregnancy, the fetus and the unborn child, the newborns, infants, young children, pregnant women, elderly, all are vulnerable to these impacts. And I won't go through the details here, but this just shows you in the community how this all can come together. The high-risk communities, thinking about a lens of health equity. How do we create communities that have the resiliency to adapt to climate change as it's happening right now? It's not something that's coming in the future. And how do we build evidence-driven policies to make sure that health impacts are minimized and health care is maximized? So what is it about women and about the various systems that we have and the exposures that might come from climate change? What do we think about in terms of the disparate health impacts? I won't be able to go through every single thing here, but there are a few things that I think are interesting that maybe you haven't thought about before. So in terms of poor air quality, the air pollutants, particulate matter, can cross the placenta, and that often will lead to poor birth outcomes. That's especially true in the lower middle income countries, but it can be true in the United States. And we know that there are quite a bit of health disparity related to communities of color with birth outcomes and maternal mortality. So we should think about it in this context of the added stressors of climate change on top of that. Food insecurity. So when we have a 1,000-year drought in the southwest of the United States and water is scarce, food insecurity and water scarcity may impact people who have higher in nutritional needs during women and girls during menstruation, during pregnancy, and during nutrition. And the malnutrition, anemia, and poor neonatal outcomes may be a climate effect there. So the underlying social, economic, cultural, and political inequities limit women's choices globally. How do we respond to climate change? Well, we all know women have major roles as family caretakers. It places extra burden, especially during extreme events that require evacuation or changing one's normal schedule in order to be safe from an extreme weather event. So there's unequal access to economic and technological resources after natural disasters, and oftentimes women don't have the means to be able to be in communication with the different groups. They may not be hearing, people with disabilities have this as well, they may not be hearing the emergency messaging. They may not know that they need to evacuate, and they may not have the means to be able to do that. There's restriction on land ownership, so they may not be able to be in control of what happens to their property and whether they get insurance reimbursement after a tornado hits or after a hurricane causes flooding. Less access to education, employment, and often lower pay. The kinds of jobs that women have in our society may be more vulnerable to the impacts of climate change, and I have a slide on that I'll show you in a few minutes. Decision making. Both in their household, local, national level, women need to have a voice in decision making because they have a unique perspective on how to protect themselves and their family for the injustices related to environmental exposures, but also thinking about it in the larger lens related to climate change. And reduced access to healthcare in general, and it might be very, very difficult for them to continue their healthcare under the extreme stressors of climate impacts. Okay, so I'm going to go through some research examples talking about the direct effects of climate change on health. So I want to talk about some studies that have been published in the last few years. So recently there was a study of over 30 million births in the United States over about a 10-year period, and they track this by ambient temperature during the gestational periods of the pregnancy, and they found a higher risk of term small for gestational age and lower birth weight babies as the temperature rose. The risks were more strongly associated with temperatures during the second and third trimesters, and especially in places that had been colder climates, because this extreme temperature may have been, they may not have been as well prepared for the impacts of a climbing temperature. So people may not have thought about this, but temperature may be a novel risk factor for lower fetal growth and for poor gestational outcomes. Now, on the other end of the age spectrum, higher temperatures have also been linked to what's known as a lower ovarian reserve. So that this may mean that women might go through menopause earlier if they've been in high temperature regions. So if you think about over the course of a temperature trajectory, they were able to see that for every 1 increase in Celsius temperature, women on average had a 1.6% lower ovarian reserve. So it suggests that steady increases in temperature, and this may happen over decades due to climate changes, may result in the accelerated reproductive aging in women, and it may reduce that reproductive period where people are able to have the children that they want. Now, I mentioned occupational exposures, and I think we can all think of examples of occupations where women are predominantly employed. There have been some research studies that have looked at risk of female breast cancer and occupational heat, and we know that they had a higher average risk of breast cancer. Risk was higher among women with hormone receptor positive breast cancer, and that jobs that might be most impacted might be those that have high heat exposure due to furnaces, in mines, people at high temperature cooks, people working in laundries, or in dry cleaning situations where we're using high temperature things. This also would include women who do outdoor work, whether it be agricultural workers in the fields or women who are employed in construction. Now we'll go back to pregnancy for a moment. If we think about the Hurricane Harvey scenario in Central Texas a number of years ago, we did some follow-up work there, and some investigators published in 2019 a study that looked at 30,000 pregnant women. 3,800 of them delivered within 40 weeks after Hurricane Harvey. Now, that must have been a very stressful time for everyone coping with the storm, but they were able to document a higher maternal mortality after Hurricane Harvey of 27%, and there was also a 50% higher neonatal morbidity. So this goes to probably interruptions in prenatal care, stressors, the inability of being able to maintain a consistent environment, home life, as their homes were damaged and they were probably displaced and then came back to their homes, perhaps either during their pregnancy or shortly after. And of course, we know that women of lower socioeconomic status, communities of color, places where their environmental justice impacts already have even higher, more complicated risks because of the combination of exposures that they, social and environmental exposures that they face. So I mentioned the mental health outcomes before, and there was a paper that was just published in the last couple of weeks that shows how during extreme heat events, there's been an increase in mental health related emergency department visits. So here are situations where people came to the emergency room and had mental health conditions, including substance abuse, anxiety, stress related, mood disorders, people with schizophrenia or other psychological disorders, people who unfortunately were showing tendencies for self-harm, and children with onset behavioral disorders. So in a time when it's difficult to cope with your environment and the things that you take for granted as being supportive of your environment are disrupted during these climate events, especially related to heat, people resort to using the emergency department more frequently in order to get their health care for these events. Now I want to talk about the indirect effects. So let's go back to another storm situation that we're all very, very familiar with, Hurricane Katrina, almost, I think, over 2 decades ago. Women with breast cancer had a 15% higher mortality rate compared to patients that were not exposed to the storm, Hurricane Katrina. And the study author here surmises that missing even 1 week of chemotherapy has significant effects on the long-term mortality. So what does that mean if your access to healthcare is disrupted for even a short or even longer period of time because of a disaster? So this is a very important theme when we think about women especially, but people who have chronic diseases, especially cancer. You don't always factor in how you need to be prepared to think about alternatives to your medical care during these events. So during these hurricanes, both in the Houston area, but you can think about it for almost any area related to flooding or hurricanes, there can be a redistribution of contaminants and carcinogens in the local areas. And so here's a study that was also done along with the pre and post Hurricane Harvey work, which showed that polycystic aromatic hydrocarbons that were in the soil in the area that's shown in this slide here, not only in the soil, but in the air, in storage tanks, and in the ship channel, they were redistributed during the disaster due to the extreme flooding. So some areas increased their burden of these. Some areas where it was not expected, where they had not seen exposure before, were now exposed to hazardous waste, hazardous air pollution, and stormwater discharging from facilities which became dysfunctional during the storm. Okay, so same scenario occurs here when we think about wildfires. Clearly, there's an amazing air pollution burden and lots of particulate matter in the air during and after the storm. The storm area is affected, but also the wind will blow the particulate matter to a much more diffuse area, and impacts can occur distant from where the fire was actually happening. And if you think about what's burning when a fire hits a neighborhood or an urban area, it's not only the trees and the forest. It's what's in the homes, what's in the businesses, what's in the schools. And we know that there are toxicants from urban wildfires that include lead paint, asbestos, transformer fluid, bleach, batteries, fire retardants, and heavy metals are found when studies are done of the soil in these uninhabited areas, compared to areas that were mostly nature-based. We see over 2,000 more chemical compounds. And the majority of these chemicals that I have listed here are carcinogens, and we know that they have long-term health effects. So these wildfires are also a danger to the drinking water, both in the local areas as well as downstream. And we see a combination of some pretty important and dangerous contaminants in the drinking water. So a lot of these volatile organic compounds find their way because of pipes that degrade during the high temperatures, but also because of the fall out from the air and these other risks that I showed you in the earlier slide. So the federal standard for benzene in drinking water, across the country is 5 ppb. In California, it's even lower at 1 ppb. And in this first column that's boxed in red, you can see the very, very high levels of benzene that were measured in water systems in these areas that were hit by these fires. And so over time, you know, the most recent ones are to the top. They're a little bit lower, but if you see in 2018, the Paradise Area Irrigation District, whoa, boy, they had very, very dangerously high levels of benzene in their water contamination systems. So the same is true for air pollution. Where do we find the effects of air pollution? Who's most systematically affected? Well, if we think about the whole climate change situation through a health equity lens, we've learned from a paper that was published last year, the figure was generated by the New York Times from that paper, that Black people are exposed to higher than average particulate matter of the smallest amount, 2.5, from all major emission groups: construction, power plants, industrial sources, cars and trucks, and agriculture. And if you think about how our communities and our urban areas are situated, many of the major highways divided communities of color. Historically, there were red line districts where housing was not preferentially, loans were not given to people of color. And so those areas have less tree cover, which can be a buffer to some air pollution. And you know, the Black and the communities of color, especially those for African Americans, are very, very disadvantaged when we think about air pollution distribution. And of course, what follows from that are the health effects that come from air pollution exposure. And we talked about that at the beginning with one of the first infographics that I showed you. So speaking of trees and tree color, greenness or shade or foliage, cover of a variety of kinds, is so important both to our mental health and our physical health. And there have been quite a number of studies over the last years that have shown that, first, there are communities that have suffered a toxic legacy of racism, that have not had the ability to have green cover in their areas. They do not have parks, they do not have shade. It's difficult for those community members to cool down under the very extreme heat conditions. And greenness and particulate matter are also interrelated here. So higher greenness areas are associated with lower cancer mortality from the PM 2.5 exposure in those areas. And we should think about planting trees, repopulating, thinking about siting parks near schools, reducing these high traffic corridor areas when possible, because they can all have a protective health effect, especially on cancer morbidity and mortality. So in my research, I have always been on this sort of environmental causes of disease, and trying to document how exposures to populations lead to our understanding of what causes disease and how it may progress. And I think what's been very interesting to me during my work on developing this NIEHS program was to think about how climate change disrupts the cancer or the healthcare continuum. But in this particular situation, I want to talk about the cancer care continuum, because we're speaking to an audience interested in breast cancer and other cancers. So, you know, the climate change impacts, the weather events can destroy or damage that healthcare infrastructure to begin with. Power outages, staff shortages, transportation disruptions, you know, reduce the access to care for everybody, but the impacts are very apparent for people who are undergoing very, sophisticated treatment regimens that require multiple visits to a hospital setting. Can overwhelm the capacity. There can be loss of medical records. In the old days, you know, loss of paper records. There can be shutdowns of the IT system due to power outages, no electricity, no connectivity. internet access, outcomes, all these things that we are now taking for granted, can end up disrupting the medical care that somebody with a particular kind of cancer would, in order for them to get their health care during this time. The disruptions to the medical supply chain, it all threatens the cancer research and care infrastructure, and it could also disrupt clinical trials that are underway. And then when we think about the causes of climate change, and we think about greenhouse gases and where the emissions are coming from, oftentimes people think about high-grade industrial complexes. But the Department of Health and Human Services and other sectors in the public and private domain are now thinking about how the healthcare system itself, healthcare facilities across our nation, how they contribute to the overall carbon footprint that is related to climate change impacts. So I learned this recently, and I think it's fascinating. The healthcare system, this infrastructure, is the second most energy generating intensive industry in the United States. And this would include the hospitals and the pharmaceutical sectors. So within hospitals, operating rooms and anesthetic gases that are used in surgery are major emission sources, and there can be best practices to reduce those impacts. And I know from a recent meeting that I attended that the people in the field of anesthesia are trying to figure out how to capture and reuse and recycle some of these gases that have these major impacts. And given its heavy reliance on surgeries, radiology services, and pharmaceuticals, cancer care may be responsible for an outsized contribution to the healthcare overall carbon footprint. So DHHS is starting a number of activities focusing on reducing these carbon footprints, looking at the federal healthcare facilities that are funded directly, the VA system, which has many, many hundreds of clinics and hospitals across the system. Those are, as an example, maybe pilot activities trying to think about the sustainability of these practices. So I won't go through this whole thing, but this sort of summarizes these various areas related to the healthcare or cancer care carbon footprint. And it's really, it really goes from everything from the patient's interaction with the technology all the way back. If you think about the supply chain and also the life cycle of any of the products and services that are being used. And there's places for intervention and improvement all along the way. And I think what it takes is people to think intentionally about how to think about this sector and what they would do to improve this situation. And if attention is given to that, then I think the populations and the patient groups are the ones that can benefit, not just the overall societal impacts, but patients can have a better experience, and I think peace of mind knowing that they're involved in a infrastructure that's being very careful about sustainability practices. So how do we talk to our doctors, and do our healthcare providers know anything about climate change and health, and how do they process all of this, and what kind of dialogue can we have with them? Well, actually last weekend I attended a group meeting called the Medical Society of Climate Change, and this was an organization developed by physicians and other healthcare providers specifically to create opportunities for learning and developing advocacy activities within the healthcare provider community. Physicians want to be able to understand climate change, and they want to be able to prescribe for prevention, so to speak. How do we protect our patients? How do we allay the concerns, the mental health challenges, the stressors that people feel living in a world where it looks like the climate change situation is not something that we can control? And the physicians that I was at the meeting with are very active, and they actually went to Capitol Hill and spoke to their congresspeople about the role that they would like to play and how they would like policy to help them along to supporting patients and their families. The Endocrine Society wrote a position paper that speaks about environmental pollution, climate change, and the critical role for the endocrinologist. They see how all of these factors interplay and impact the diseases that those physicians and healthcare providers are most aware of. And things like being more intentional about eating a plant-based diet, reducing meat consumption, choosing active transportation. These are things that we know can impact on major endocrine disorders of obesity and diabetes. So we can take what we knew before, and if we can practice those or move towards practicing some of these recommendations that have been out there for a while, not only will we be helping ourselves and our health, we will also be creating a healthier environment, not for only for us, but also for future generations. So as a cancer patient or a family member of somebody who has had cancer or is going through cancer treatment, how do we process all of this? Well, choosing active transportation that reduces greenhouse gases. Things like electric vehicles, taking buses that are low diesel or clean natural gas. Increasing our own physical activity can improve cancer risk and improve cancer survival. I spoke a little bit about the meat and the plant-based diet. Well, if you think about the whole ecosystem of how our food is produced and trucked all over the world, and it has a big carbon footprint, and how agricultural processes, especially in the meat industry, may lead to increased levels of methane or other greenhouse gases. I have thought twice sometimes about whether I want to eat red meat or I want to eat a plant-based food. And it's now being sort of, I've added it to the kinds of risk analysis I do for myself when I think about how I would want to approach this, not just for me, but for the planet. It's really important for people to have a disaster preparedness plan, and I know many communities are working to help people do that. Certainly, if you live in a wildfire-prone area, being prepared for a disaster, living in the areas where the hurricanes are most prevalent, it's important to be ready. But your own medical care and the kinds of medical issues that you may have related to your cancers, your family members' cancers, or other chronic diseases is critical to have a plan with your provider, understanding what your hospital resources would be if you're in the middle of treatment or if you need diagnostic services. And make sure that you talk to family, friends, and neighbors about what you need so that they may be knowledgeable and may be able to help you in that disaster to make the outcomes better. So I want to close with just sort of a big global view. Women are key to solving many of our environmental problems and the climate crisis. And if we look around the world, there are many women in positions of leadership at countries in lower middle income countries. That's true in sub-Saharan Africa. We have women in positions of leadership across Europe and in Asia, and we have more and more policymakers at the state and local level who are women in the United States. So women are educators, caregivers, leaders, innovative, and agents of change in their own communities. They prioritize family and community in all their decision making. And research shows that women tend to grow greater concern for the environment and issues of inequalities than others in our population. So including women in climate and health decision-making leads can lead to a more effective, equitable, and sustainable solution. And I am very taken every time I see in the TV, on social media, or in the news, the number of our younger women who are stepping up and leading global activities related to climate justice. So I'd say get involved, be mindful of these issues, have your daughters and your granddaughters be involved, because not only does climate change impact our women and our children, but that women can be the key to solving the crisis. Thank you, and I am going to take the slides down and be available for any questions or comments that the audience might have.
Thank you so much, Dr. Collman. That was really fascinating. And I do want to invite any of our participants who are on the line with us that if they do have a question for you, they could type that in the chat. And while they're thinking about if any questions they might have, let me ask you one that came up for me. I saw that, you really talked about the role of women both in impacts to climate change and in solving climate change. Are women more susceptible to the impacts of climate change than men? And if so, how?
Well, it's an important question, and it's a hard thing to quantify, right? So a lot of the a lot of climate impacts are local, right? So if you live in an area where you have more weather events, you see changes in temperature, you experience the effects of wildfires, and you may, based on a whole host of vulnerabilities, you may be more susceptible to the impacts of climate change. There are many diseases that are more prevalent for women than men, and there are different susceptibilities for those. And so it's this direct and indirect drivers of climate may impact this. It's very hard to tease out, and I'm not so sure that there's been enough research that specifically focuses on whether men or women are more or less susceptible. And we can't look at all of the climate as one variable, right? There's so many different parts to it that it's a very hard question to answer directly. But I would encourage people who are listening that are researchers to really think about that question, and in the design of their studies to think about are we seeing male-female differences in the impacts? Are we seeing male-female differences in the interventions that might come from what we're learning? And then when we think about creating resilient societies, do women need different supports and different ways to be resilient than men? I think all of these are really important questions to answer.
Thank you. We've gotten a couple of questions in. What can we do to lessen the burden of climate change related adverse health effects on women, and specifically on Black women who have the highest breast cancer mortality rate?
Yes, that's a great question, and I would have hoped there could be an easy answer now. I mean, these are problems that we've been facing for a long time, and we are right. You know, we are in the middle of the climate change impacts. So personally, people, I think, can take good care of themselves, and they can make some choices about how they think about their environmental risks. These prescriptions for prevention that I've spoke about, that other people have put out there, really focus on general principles of health promotion and healthy living. I think you need to protect yourself and know in advance if you're a person who's very susceptible to heat. Like I personally get overheated all the time, and I'm a fainter. And so when I think about, am I going to go to a place where there's no air conditioning or no way to get relief, then I have to think about hydration and increasing the amount of water that I may take in a given day, or else I'm going to fall flat on my face. And I have done that more than once, and so I know what that feels like. So I think you need to have a plan for yourself, and you need to talk to your healthcare provider about that plan. And I think you can make impacts at your personal level in many ways. In your community, I think you can get involved in community planning and activities, bringing awareness to policymakers locally, listening to how your town is dealing with climate change and getting involved, knowing what the climate action plans are for your area. I think there's a lot of good information for people to take on personal behavior change to do that. And be mindful of the carbon footprint that you make yourself or that you participate in. Things like going to get your groceries at the farmer's market, promote a local economic development of close by farmers, but also has climate impacts.
As we're talking about specifically people with cancer, not just women, but all people who might have cancer, what are some concrete steps that they should be thinking about to be prepared for extreme weather events?
Yeah, I think some of the papers that I spoke to earlier, and there was a checklist in one of the graphics on the slides, shows, ways to be prepared. So, thinking ahead about your treatment schedule. If you come to a season where that you're going to have repeated threats of hurricane. Like I live in North Carolina, so we have a hurricane season, and being prepared during that time. Speaking to your healthcare providers, your nurse practitioners, and your doctors about scheduling things. Asking them, well, what's the backup plan? If electricity goes out in my region and I'm scheduled for a treatment, how can I be assured that I will get the next available appointment? What will be the outcome if I don't have access to my medication on a given day? I think the more you know about how you can deal with that, this really would be settling for somebody. I could see huge anxiety and stress when, like, a Hurricane Katrina hit and there were so many patients, that didn't know how they were going to get their usual medical care. Perhaps having, extra supplies or materials in your house that help to support you through your treatments, and then, be prepared. The same kinds of messages that you hear about general preparedness, extra water, making sure you have food for, a certain amount of time if your electricity goes out. I think another really important thing is making sure that you have tight connections to your family and, community supports. So people in your neighborhood who can help you, navigate when something stressful like this happens, to me would be a great reassurance. I know these aren't really very concrete, easy to say, but I think I think people who are unfortunately impacted by cancer become very smart about their health, their situation, what they need. But I think this is another thing to add on to the list to make sure it's in your mind so that you're not caught off guard and feel unprepared in the moment.
What does it mean when you say build a resilient community, a climate resilient community? What does that mean?
Right. So communities that don't have strong infrastructure. So if you think about parts of the developing world, right, where we don't have paved roads, we don't have secure or clean water systems. I mean, those communities for big climate events are the least resilient, right? They don't have the infrastructure. They don't even have the government supports to come in and clean up homes or any of that. So, you can think about that on the extreme. In the United States, you think, well, all of our towns, must be able to handle stressors that happen on any given day. That's what we have local governments for. But there are some communities that are less resilient. Why? Well, some communities have an unfortunate toxic legacy of environmental exposures. People live next to large oil refineries that maybe could be breached, or there could be a hazard related to an event. Those communities have to be prepared. They have to think in advance. What would happen if this scenario occurred? If a community has never gone through preparedness activities, or this kind of stuff isn't even on their radar screen, unfortunately, the community, the infrastructure will be less resilient. The impacts to the people will be more, right? So you think about a climate resilient community, you think about both the governmental infrastructure, the housing stock, all of the, the supply chain issues. I mean, we saw through COVID, sometimes we as a nation were more resilient than others when we had stuff available to us to be used and, was appropriate to the level of the pandemic. If you don't have that in place under the lens of climate, then unfortunately communities that have been disadvantaged in so many ways over time continue to be disadvantaged and impacted more because of the climate direct and indirect impacts. Does that make sense?
Yeah, it really does. And it makes me think about even my own local neighborhood, right? Of what might potentially be there that I may be aware of or may be not aware of.
Mm-hmm.
How can research help us deal with the impacts that are happening right now?
So there's a kind of research right now that's called adaptation research. And we have that in our cogwheel diagram that I showed you. And this is really to think about not research that we can use in the future, but it's research that we can employ the evidence right now. So many of these things that I talked about in terms of resiliency can really be things that we can do small studies, we can add information into studies that are already occurring. We can look at the systems that are happening in local regional areas, and then we can make adjustments to those things pretty rapidly from the evidence that we get, right? We do not need to have 50 more years of research to document that we have more weather events happening in certain parts of the country. We are already seeing that. So the kind of research that we want to do is practical research to try to improve the situation, make people resilient, reduce the impacts. We also see that through policy changes, there will be mitigation strategies that are already occurring, changing to electric vehicles, building different infrastructure, improving air pollution in some areas. So measuring the current health co-benefits of those changes that are occurring is very important information to give to the policymakers now to show evidence that the kinds of climate friendly changes that we're seeing can have true impacts both on the health of the community, but also on the health economics, right? Because we want to be able to prevent disease, we want to reduce the impacts of disease. And if we're already seeing that cleaning up our environment, reducing greenhouse gases is having positive effects, that would be a positive driver to continue that kind of work.
Thank you so much, Dr. Collman. This has really been a very thought-provoking presentation today for really looking at that interface between, really climate change, our environment, and how it impacts our overall health. Whether we're healthy or we're undergoing cancer treatment or we have been in recovery for a long time, we all have to think about this, not just for ourselves, but for the legacy that we're going to leave for future generations. So thank you so much. And I know that you're very busy and need to get on with your day, so really appreciate your participation in today's webinar. Thank you, everyone, and thank you, NBCC.
Thank you.